So, hello, Angelo. Nice to meet you. Good that you're here. Tell us about your background. How and when did you decide to become a dentist?
Hello everyone, I'm very excited to be here today in Cologne, and thanks Edra for hosting me. I think this book is a unique book because in this kind of manual you can find a new approach in the treatment of impacted teeth. And I decided to start this project because during my daily activity I focused my surgical procedure in the extraction of impacted teeth. So, is it possible to reduce the invasivity of this procedure? And the answer is absolutely yes. And you can find the answer here in this book.
So, that's one of the highlights. Do you have more highlights in this book? What would you mention would be the highlights of your book?
Yes, this book is divided in 11 chapters from the anatomy to the complication, passing through the surgical steps procedure and the use of the piezo surgery, the use of the ultrasound waves in the treatment of impacted teeth, not only third molars, but all kind of impacted teeth. So I think this is the unique approach in this kind of surgery.
And with this 11 chapters, right, what kind of audience do you want to reach?
This book is for the general dentist because with this procedure you can have a very safe in this approach, and also for oral and maxillofacial surgeon. So for both of them, I think this is a good guide in our daily practice.
That sounds very interesting. Do you have a little view for us? How does a typical day in your practice day look like? Could you describe it a little?
So basically, I love my activity, I love the surgery, and I think one thing very important in our practice is to follow always the protocol in our procedure. So if we will follow the protocol, we will have a better result for us and for sure for our patients.
And is there anything you want the people to know about your work, about your passion?
I think I spend a lot of my time in the clinical procedure, but also I spend a lot of my time to find a new solution in order to minimize the surgical procedure for our patient, because we don't forget that we need to follow the protocol to have a good result for our patients. So the patient first.
Very good. Patients first. That sounds very interesting. And maybe there are students first too. So do you have advice for the students, like, or people who are considering in a career in dentistry?
Yes, I think it's very important in our practice, especially in the surgical field, to have a good knowledge, not only for the theoretical part, but especially for the practical part. So for this reason, for example, I do a lot of courses for the students, but not only theoretical courses, but especially practical course on patient, on models, because I think it's very important to improve our practice during our education program during the years, especially for the students.
Thank you so much for your time to
My
be
great
here,
pleasure.
and have good days at the IDS.
Thank you very much. My pleasure.